I think that we're all eager to know on what structure the hospital and the hospital system is working uh, on, but maybe we could start with the most local, and if you could outline how Shore Health participates in that.
So we work under what's called a hospital incident command structure. And that, again, directly reflects the incident command structures that are out there in other municipalities. And what it allows us to do is have positions, have responsibilities and functions that really are similar to what local emergency operation centers create, what states create, and what nations create to combat unplanned events. We have a structure like that at Shore Regional Health, and it really starts at the top with the incident commander. And for Shore Regional Health, our incident commander through this pandemic experience is Dr. William Huffner. Dr. Huffner is our incident commander, but he is also by day our chief medical officer for Shore. And he's in a very unique position as incident commander, because I don't know if you know this, Dave, but Dr. Huffner is actually an emergency medicine physician by trade. And with that background and experience, Bill has been through it all. He's experienced everything as an ER doc, as you can imagine, and really has the skill set, the quality, and capabilities to help lead this incident command center for us. But I think Bill would be the first one to tell you that in this particular incident with our pandemic, you really need that medical technical specialist at your right-hand side. And for Shore Regional Health, we are so fortunate to have Dr. Rosa Matea. Dr. Matea is our infection preventionist. She is really working on state-of-the-art processes, procedures, the right things to do to care for our patients safely, and also most equally importantly, care for our team members as well. So the tandem of Dr. Huffner as incident commander and Dr. Rosa Matea as our medical technical specialist really is helping us lead our incident command structure here at the Shore.
The other thing that you all are participating in is with the county level. Is that correct?
As you mentioned, Dave, is the emergency operations centers that are set up at each one of the counties that we serve here at Shore Regional, each of the 5. They have a very, very similar structure. Incident commander, medical technical specialist. They've got chiefs and officers that run the operations for the entire county. So what we do is we have representatives from our incident command on those emergency operations center calls every day as well. So there's a direct correlation between what we're working on and what our capabilities are, right back to the counties who are managing the entire county responsibilities. And we do that for each of the counties that we serve.
On a structural level, you also have one with the University of Maryland, right?
What I believe to be one of the most important benefits of being part of the University of Maryland system is the size, the scale, the scope, the recognition, the reputation, the expertise that is University of Maryland. We have leading experts in the field who have also set up an incident command structure within the University of Maryland system. And what's really fascinating is that through that structure and our local structure, information flows back and forth freely and effectively. Policies, protocols, procedures that come down and go up through these incident command structures are effective, they're efficient, they're timely, and they're evenly and accurately distributed throughout our entire system. 13 hospitals, almost 30,000 employees, all operating under the same structure, under the same uniformed approach, which really makes this safe, effective, and very, very valuable for the communities that we serve.
Could you give me an example of how that works?
So when CDC or world-renowned guidelines come down to hospitals across the country, and they say things like having your team members wear masks, things like having your team members get their temperature checks done, things like restricting visitors into our healthcare system to keep our community and our patients safe. These are all examples of things that the incident command structure allows for that up and down communication, so that once these policies or protocols are established, they are clearly and articulate, and they're clearly communicated to each of the affiliate hospitals, and then they're operationalized effectively and consistently across the board.
As an extension of that, in terms of shared resources, early on, there was a great debate, there probably still is, about ventilators. Is there a pool in which Regional Shore can participate with that?
And as part of the system, we have 13 hospitals that each have their own inventory of supplies and equipment, their own inventory of personnel, their own capabilities and strengths. And we, as a part of that system, really are able to partner, collaborate, and benefit from the size and scale of a $4.5 billion organization. And so it's not only the technical expertise that we can get from the incident command structure, but also the availability of resources that we're going to need to safely manage this pandemic. Unlike any other event that we're usually using this structure for, like a hurricane or a fire or a tornado, this has been ongoing. We're 6 weeks into this pandemic, and we're going to be in this world for several more weeks to come at least. So I think having that resource as part of the University of Maryland is really going to help us get through this and on an ongoing basis for the weeks and months to come.
Do you have needs that are not being met now?
I think some of the needs that you hear about or read about across the country could reflect things like test kit availability or specimen collection kits that are available. This pandemic is going to be resolved, in my mind, by having testing, more testing availability, and really then isolating those individuals that are positive and managing that on a patient-by-patient, community-by-community level. In order to do that effectively, we need appropriate collection kit material and test kit availability. And I know the state is working incredibly hard at getting those resources to us. Early on, it was a challenge, and quite honestly, it delayed it delayed our ability to identify who was positive and who wasn't, and that used some resources as we were waiting for those results to come back. PPE, personal protective equipment, you've got to use it. If you don't know for sure, you have to assume positive until you're told differently. So it's those kinds of things that through more testing ability, we're going to be able to better handle our resources and better care for our patients.
You know, walking by the hospital the other day, I saw a gigantic sign, you know, saying thank you to health workers. And boy, you know, everybody's worried about their stress level, their anxieties. You know, could you speak to the employees and what they're going through?
I think what this pandemic has allowed us to do is get a glimpse into our healthcare world. See that our team members are dedicated, they're caring, they're compassionate. They show up every single day to do the job that they're called to do, quite honestly. And it's so gratifying to me to see our community recognize that, appreciate that, and say thank you in so many different ways.
Another anxiety that's come up, or maybe it's a concern for the hospital too, is people are sometimes delaying seeking treatment because they think they won't be, you know, be able to be admitted, or they won't be in the back of the line.
The message I'd like to give to our community is, if you are in a life-threatening situation, please call 911. We are open for business. Our emergency rooms are open. If you need emergency room or hospital care, we are available. We need you to call those numbers and use our services. The last thing we want to have is our patients continue to deteriorate because they have a fear of coming into our system. You know, we will care for you safely. Our team is equipped with the appropriate supplies to care for you safely. We are here for you, and you have to use the resources of 911 or our emergency rooms and our hospitals if needed. So I'd like to get that message out to our community.
You know, there is a lot of people who are anxious to get a sense of the metrics involved in Regional Shore's preparations for this. There's a lot of reasons why you're deferring to the state in terms of sharing that data. Is that correct?
That's correct, Dave, because we are one component of this pandemic. And I'd like our community to know that we provide the information that is relevant to our hospital system to our local health officers, who are responsible for managing the counties they serve. And they get information from a variety of other resources so that they can ultimately have the full picture that is then communicated up through the state. So it's important that as this situation continues to be dynamic, and evolve quickly. We stay in lockstep with our local health officers, give them the information they need, and allow them the open communication back and forth to make sure that they're comfortable with what the overall picture looks like for the communities they serve, and that information goes up to the state for an appropriate, accurate, and timely piece of information about how we are managing pandemic.
How do you see the end of the
Well,
road?
I don't like to project how this is going to end or where this is going to end or when it's going to end, but I feel so grateful to be part of a healthcare team that is really patient-centered together, because it's going to take all of us to get through this, and we're going to work collaboratively through that structure that we talked about to make sure that we're all on the same page and working as collaboratively and effectively as we possibly can.